and welcome to Outside the Box 2020, the Healthcare Edition. And we're here today again with Dr. John Rothwell. Hi, Dr. John. How are you doing today?
Hey, good morning, Jannis. And just like you, I always have my one thing to say. I'm Dr. John Rothwell. I am an advanced practice registered nurse, board certified family nurse practitioner.
Very nice. Thank you. Saves me from having to do all of that. We're a little jerky today. My internet connection maybe is still not as smooth as I'd like for it to be. I noticed that when I move, I'm a little jerky. So can you hear me okay? All the audio is good?
The audio is perfect. It's just fine. And you look rather nice as well.
Thank you. Thank you.
I
had
really
to change
like your new, well, not your new, but it's a different background with the well, and it's very very ocean-like. So
thank you. Yeah, Fred and Flipper called out sick today, so they're not here. They don't make coffee anyway, so I was thinking about letting them go. I got my bear buddy is over there in the chair. He doesn't make coffee either, though.
Here we go.
Cannot get good help.
Right.
So tell me, what is on your mind today?
Well, what's really been on my mind the past few days is this is the first week of phase 1 of people really going back into the community.
Yeah.
And now on some mornings I just drove to work thinking, wow, there's still a lot of people out and about. But now we're seeing, restaurants opening. We're seeing some of the service industry starting to come back. I went and got a haircut. Yes, I got a haircut the other day, and to see how the community was adapting, especially the small business community was adapting to the recent ability to go out and start making a living and trying to find out what is the new normal.
So I just have to tell you that, I changed locations because we were having some technical issues. And when I did, I moved my computer without the power source. And so now I just got a notification that I have 11 minutes left.
Well, you know what? That's not necessarily a bad thing because we're always really pushing the time limit. So, There we go. So I was talking about the phases, and rather than just kind of waiting for a question from you, I'll just go ahead and move forward and say, okay, great. So now we're in phase 1. People are talking about phase 2. I talked to one of my patients who's a massage therapist, and she's allowed to start seeing her patients or the customers next week. And I'm thinking about, it's been about 8+ weeks or so since we've been quarantined. And there's still people showing up positive for the SARS-CoV-2 virus or the COVID-19 virus. And I wanted to just kind of let everybody know, in my experience, I've had about 37, up until this week, about 37 positive COVID-19 results. And that's in conjunction, not necessarily with Island Direct primary care patients, but I've been leading a COVID task force with MedFast Urgent Cares across their 12 clinics. And we've tested hundreds and hundreds of patients, even well over 1,000. And so percentage-wise, it hasn't been that great. But what's been interesting is how long people actually are showing up positive with the virus. And you see a lot of different things in the media. And yeah, really. And so interestingly, the patients vary from the ages of about 22 or 23. So these are some of our first responders in our community.
Hold on one second. I really, really want to continue this conversation. So I'm going to go grab my power cord.
Okay.
While you continue to talk, because I can still hear you and weigh in. And I also want to stop for a second and just for reference sake say that the date today, the date that we're recording this, is May 15th. It's a Friday. So we're on the end of the first week, right, of phase 1? Okay.
That's correct.
All right. So you continue talking. I'm going to go get my power cord.
Awesome. So it'll be great talking to an empty screen. I got the whale
I
in the
know, it's
background.
wonderful. See, and you can still hear me. I could just sit over here and sip my coffee while you talk.
So, I tested my first patient in late March, and that patient actually showed positive all the way towards the end of April. And when I say tested positive, I'm not talking necessarily tested positive for the antibody screening that we hear so much about right now, but I'm talking about the molecular testing or the PCR testing where we're actually testing the RNA of the COVID-19 virus. And so the patients that I've been caring for, they may only have symptoms for 3 to 5 days, then they're afebrile for 72 hours, and we start to use the Center for Disease Control process for return to work and these kind of things. And we go ahead and do a nasopharyngeal or the nose swab, right, to see if they're still positive. And guess what? They are. And they were
And that's
positive.
how long after the initial diagnosis?
So from the initial diagnosis to the first time we were swabbing them was right around 14 days after onset of symptoms. And they
Okay.
were afebrile for 72 hours, and they had a decrease in symptoms. Now, there's 5 particular patients that I've been tracking, and then 2 separate ones. So a total of 7 that I've been tracking across the community. And out of those 5, one of them had symptoms for 3 days and then no more symptoms. 2 had symptoms for about 3 to 5 days, then no symptoms for 2 to 3 days, with the exception of loss of taste and smell. And then they ended up getting fevers again for a day, and then 2 more days of no fever, and then fever for again. And so what we saw was it was very difficult to say, when do we test them? When do we do an actual a nasopharyngeal swab? Again, the swab that goes just not in the nasal passages, but all the way back, and to see if this patient actually still testing positive for the COVID-19 virus. So the shortest time frame was about 20 days from onset. My longest time was over 30 days. And interesting enough, that was testing for the PCR, which is the molecular testing. And then I actually compared them to the antibody testing to make sure our antibody tests were actually accurate. That's been a big thing in the community now, is people saying, well, there's all these false positives or all these false negatives. So I think if you can take people who actually tested positive and then do the antibody test with them and see if they test positive, and they might test positive for IgM, which is your short-term antibody, or IgG, which is your longer-term antibody, or sometimes both. When they test positive, we actually test them again for the molecular PCR testing to see if they're still positive, to see if there's really a correlation between the 2 testing. And interesting enough, we actually found 100% correlation so far with our patients who tested positive with the PCR testing, and then who came in and had the antibody test. And that's been really interesting. And then I mentioned those 2 patients that I was tracking separately. There are two flight attendants, a married couple. One of them had symptoms, the other one had 0 symptoms. The patient who had symptoms came in, got the nasopharyngeal swab, and tested negative. His husband came in and tested with the nasopharyngeal swab and tested positive, and he had no symptoms. So here you had a patient with symptoms who tested negative, and then you had a patient who had no symptoms that tested positive. So because we're a small community, 573,000 people in Brevard County, but within the MedFast organization or within the Island Direct Primary Care organization, we have the flexibility to respond individually. So we called those patients back to do a telehealth visit to follow up on them. And the patient still had not had symptoms after 7 days. So they wanted to go back to work. The one was negative. So he's like, look, I haven't had symptoms for 7 days. The one was positive. He's like, I never had symptoms. So can we get swabbed again? So we did a swab on both of them again. And then we sent them to a different lab than the first time. And guess what?
What?
Results were the same. The patient who was asymptomatic was still positive, and the patient who had originally had the symptoms was still negative. So then we did the antibody test.
Okay.
Okay, let's do the antibody test and see what happens. So we did the antibody test on the patient who was negative first, and that patient was still negative. And then
No antibodies.
no antibodies.
Okay.
And he lives with someone who has COVID-19. And so then we did an antibody test on the patient who tested positive for COVID-19. And guess what? After 21 days, he had antibodies. He actually had IgG, which now says no IgM, no IgG. So therefore, he should have the antibodies and have some form of immunity. For how long, we don't know. And so we swabbed him again with the nasal swab to make sure that, again, it was accurate. And it came back negative this time. And we sent it to a different lab. So these are some of the things that when you have the flexibility like Island Direct Primary Care does, and I've really been working as a executive advisor to the Chief Medical Officer, David Williams at MedFast, on following the COVID-19 virus within our community, because they, MedFast has facilities north Brevard, central Brevard, south Brevard, and even out at the beaches. And so as a primary care provider in my own personal practice, we kind of have a strategic partnership where patients often go there. They don't have a primary care provider, and so they kind of get referred to me. So it's kind of a joint relationship where we help out one another, and it gives me access, right? I don't have the manpower or the political clout to really kind of dive into what's happening into our community from a legislative perspective. And so I kind of use that relationship to work amongst the commissioners in the emergency management system. So just to kind of reiterate, what I've seen is patients actually testing positive for the virus for 14 days, but actually testing positive for as long as 30 days. And recently, there was one of the recent publications in our community, one of the media groups, who were saying, somewhere between 14 and 20 days. And they were talking about some of these first responders who were positive. And we actually had to send them a letter saying, look, this is not accurate. We're actually seeing patients positive for 30 days. And they're like, well, we haven't seen that in the literature. That's not what we reported. So I delved into the literature. I'm a doctor of nursing practice, and so that's what I do. And so I found multiple articles. Think of a literature review and a meta-analysis. A meta-analysis where you take a bunch of different articles and you kind of see the correlation between these different articles and what's common between them. And I was able to reveal that there was between 20 and 24 days was probably the most common groups reported, but there was actually signs and symptoms in viral shedding, whether it's residual or not, who knows, up to 37 days after onset. 37 days. So here we're in phase 1. We still have patients who are testing positive who could then be shedding the virus for 14, 20, 37 days. We don't know. And we're still out in the community. So I think it's not to live in fear, but to be cognizant of your surroundings. And that gets with the basic hygiene stuff. It's not polite to cough in someone's face. It's not polite to cough without covering your mouth or sneeze without covering your nose. I mean, these are
always,
etiquette things. Let's use good etiquette amongst our community amongst our family members. And if we do that, then, we'll continue to reduce the spread of the virus. I would encourage people to continue to ask questions of their primary care providers. Be cognizant of what you're watching on social media. I've seen everything from scientific talks to conspiracy theory talks. I watched a really interesting video last night on YouTube. I think it was published about a week ago. I think it was on Hightower, and it was a physician out of Hawaii who was specialized in internal medicine and endocrinology, but his primary focus was on the body's biome, or the gut biome, if you will, all the bacteria that live naturally in our gut, and then talking about the viral biome and evolution. And he even went back as far as when you remember the Ice Age, you remember when the whole world was covered with water, you remember when, and we don't remember personally, but we read and studied in school. So we had 5 times we've had these layers of extinction, and now we're in the 6th one, and now we're humans in this 6th level of extinction. And so we're actually actively involved in what's going on. Viruses and bacteria have been around much longer than we have. So what makes us think we can actually control them, right? Our bodies were built with an immunity system. So I encourage everybody to focus on their immunity system. In other words, increase your sunlight. You have to be outside to get some vitamin D. You need vitamin D to increase your immunity. Go ahead and take your vitamin D supplement, because most of us here in America are deficient in vitamin D. Zinc is huge. You should have at least a minimum 25 milligrams of zinc, but a good multivitamin will have zinc and selenium in it. If you're not into taking vitamins, Brazil nuts, eating 3 Brazil nuts will give you the selenium that you need. And then, of course, your omega-3s and vitamin E and vitamin A. So cold water fish like salmon, haddock, dark green leafy vegetables, do those things. And then for those people who tend to have lower immunities, I would argue that increasing your vitamin C to 2 to 3 times a day, in other words, every meal, take 1,000 milligrams or so to increase your immunity. So let's build up our immunity system, and we have a greater chance of not if, but when we are in contact with new viruses, whether it be COVID-19 or any of the other coronaviruses that we may have been exposed to in the past, we have a better chance of remaining healthy with that. And, we can get much more granular and scientific when it comes to COVID-19. Some of the interesting things like COVID-19 not necessarily being a respiratory virus, but being more of a hypoxic virus. In other words, a virus that challenges the blood in your body to transport oxygen to the organs in the body, which we have seen in COVID-19, multi-system organ failure, and where we see people coming in feeling great, but their oxygen levels low. And I think you and I met early on, and you just felt like you couldn't catch that breath, right? And so we were checking your oxygen level, and your oxygen level was good. So, did you have COVID-19 or not? Not sure. We'll check for antibodies at some point as we kind of continue to determine the validity of the different tests. And see what's going on. In the meantime, we'll continue to watch the literature, not only in the United States, but across the other countries to see, how has COVID-19 really affected the body? Because what we've seen is we've seen lung issues, we've seen heart issues, we've seen multiple system issues. And so when you think of multi-system issues, then the question is why? Is it because of the patient having comorbidities like chronic obstructive pulmonary disease, coronary artery disease, diabetes mellitus, liver disease, renal disease? Is it because they already had another disease process? You know, the United States has a lot of chronic illness amongst its community, probably starting off
We
with
do.
obesity, right? And so is it that? And look, I'm not saying there are young people who were young and healthy who contracted COVID-19 and were not able to combat it, and they passed away and they're no longer with us. And so the question is,
That's a small percentage,
it's a
right?
very small percentage, but you know what? If it's my family member,
That's
whether it's
right.
0.1% or 10%, if it's my
I
family,
agree.
I don't care,
I know. I
you
know.
know?
I know.
And
But it's
so,
from a big picture, though,
yeah,
you
from
know,
a big picture.
from a big picture. I totally agree. I do. You know, from a sensitivity standpoint.
Yeah, and I think that's the nice thing about, you know, that nursing approach, right? You know, we tend to be, we're traditionally trained in caring. From a
Right.
nurse practitioner perspective, we take advanced pathophysiology and advanced pharmacology and these kind of things. So we're studying medicine, and but we don't lose that compassion and that empathy for caring for people. So a lot of times we kind of go down that road first, and then we start to delve into the medicine, and that has its pluses and minuses, of course. So sometimes it takes you a little bit longer to get to your answer. So for me, it's perfect because Island Direct Primary Care, we have a small patient panel size. I spend an hour with my patients if they want, but I only see one patient an hour, and that allows us to kind of get to root cause analysis of problems versus just treating a symptom and giving a pill. Definitely not my approach to care. I like to focus on what I consider my 5 pillars of wellness: physical, mental, spiritual, financial, and emotional wellness. I take a 4-tiered approach to that, right? So that's lifestyle changes first, food's the best medicine. Let's look at your minerals and your vitamins and see if there's any need for supplementation, and then implement pharmacology, which there's a great opportunity for pharmacology given the right circumstance. But I think sometimes we're a little too quick to go there in that direction.
I agree with that. And, you know, interestingly, those 5 pillars apply always, of course, but really, really apply to this COVID-19 thing. It's funny because this morning I had a moment, and it's been a little while since I had a moment. But I was like, I don't know, I just felt kind of not really overwhelmed, but just weary, a little weary with all of this. And then if you let yourself think about too hard, if you think too hard about what's coming, you know, what's happening. So I read this morning that the governor announced that we're rolling into phase 2 next week is our phase 2. And I thought, you know, I mean, that's good. And it's, I don't know, like, I just had this moment where I felt like I don't even know how I feel or what I think, or I just want all this to stop. I just want to like roll back the clock to February and have a big do-over. So, you know, it incorporates all of those things. It's weird times that we're living in.
It is. And, you know, from my perspective, to be honest with you, I'm actually kind of grateful for what's going on. And that includes the COVID-19, the SARS-CoV-2 virus. And here's the reason why. One of the challenges we have as healthcare professionals is working with patients to take ownership in their healthcare. And unless you're actually experiencing it and seeing it, it's very difficult to change. And you know, we can have another discussion on social cognitive theory and social change theory and these kind of things. But getting someone to see the importance of being healthy is very, very difficult, because the first thing out of their mouth is, I know, I've always been told that, you know, every doctor I've ever gone to is change, you know, eat less, exercise more. And you know, we all hear that, but until something affects us personally, whether it's personally in our own individual body or personally with our family or friends, it's very difficult to really take change seriously. And I think with COVID-19, what I'm grateful for is that maybe, just maybe, people will look in the mirror and go, am I ready? Am I ready to change? Am I ready to go to the next level? Am I ready to die? You know, do I have everything in preparation for that? And look, birth is a very beautiful thing. And one of the neat things that I heard last night on this YouTube is, we're kind of born to die. And I think we've heard that before. It's like once you're born, you live the rest of your life not knowing when death is going to come about, because tomorrow is not guaranteed. Sometimes through tragedy, sometimes through age, we just don't know. And so, I would challenge that if we're going to live our best life with not knowing when death is going to come, then we need to do some change, right?
Yeah.
We need to kind of look and say, are we prepared? Because I don't know about you, Jannis, but I want to be ready. And so I want to be ready every day. And so if I'm going to be ready every day, I have to look at my best self. So what's the best way to do that? And sometimes I have accountability partners. I have 4 men who are like-minded. We're all in difficult physical shapes and sizes, some married, some not married, but we sit spiritually very similar. So we spend a lot of time together saying, are you doing your part? Are you taking action? And so me, as the provider for Island Direct Primary Care, I focus on how can I help my patients take action. I don't have to take the action. They have to take the action. And so how do we get to owning it? And I want to own it with them. And so that makes it very special to me, as you know.
Yes, I do. So one of the takeaways from our conversation today that I'd like to dedicate maybe a session to is talking about the after effects. Some of the things that you talked about were very interesting. The cases where, you tested this person and they were negative or they were positive, and the antibodies and that sort of thing. So I'm really interested in that. Let's put that on our list to talk about, dedicate a session to that. And but I did have one question. So is it possible for someone to test positive for antibodies, but still have the active virus so they would be contagious? Is that possible?
Absolutely.
Really?
Absolutely. Absolutely. Because remember, when we're testing antibodies, we're testing for IgM and IgG. So IgM is your, in layman's terms, your short-term antibodies. Relatively soon after infection, your body starts to build antibodies, and IgM means you're in the active phase. And then IgG kind of starts to occur later. Those are your long-term antibodies. So when we're doing the COVID-19 antibody screening, I like to say screening, not testing, screening for the antibodies. If they're positive, we always fall back to the RNA testing or the PCR testing to see, are you actively still positive? And we have found in many cases, even if it's just IgG and you test at the right time, the patient will show positive for the virus. And so it's not, and we do that, by the way, because a lot of these antibody tests haven't done cross-reactive testing. And so, as I've mentioned on a previous interview, is that there's 7 different coronaviruses, and 4 of them make up 10 to 30% of our respiratory infections that we typically have. One of the things that I've done to, and you haven't seen this, but one of the things that I've done to really just kind of weed out the what ifs or what is it, because everyone said, okay, I tested negative, then what is it? Why do I feel so bad? And so I partnered with a laboratory that actually will do the COVID-19 test if you're symptomatic. They'll do it if you're not symptomatic, but the cost burden doesn't make sense to me, so I don't do it unless you're symptomatic. But if you're symptomatic, we do the COVID-19 test. If that test comes back negative, it falls back to a respiratory panel that test for multiple viruses, including specifically the 4 different coronaviruses. So it will tell us if you have a coronavirus at all. It will reflex back to influenza or RSV. It will even reflex back to bacteria. So I had a patient yesterday who called up. She just knew for sure she had COVID-19, but she was positive for Streptococcus pneumonia. She had pneumonia. And here she was thinking she was treated incorrectly, and yet she was given the right antibiotic for the right infection. And so she had a pneumonia and bacterial pneumonia. And so she was treated for that. And so,
I actually have a friend in Georgia who thought for sure she had COVID-19, was horribly sick. I mean, horribly sick for well over a month, and did a lot of the things that you mentioned, you know, like had the symptoms and then seemed like she was getting well. And then all of a sudden she was sick again. And then her daughter got sick, not quite as bad as she did, but still was sick. And she got tested and the lab lost her test. So she didn't get the results back. And so bless her heart, she was so sick. Well, then she finally was able to go back and get testing, and she had pertussis.
wow.
Right? Like, shocking. And so she shared, you know, all the information about it. The whole family, you know, had been exposed. Her husband was a high risk because of some pre-existing conditions. So he stayed away from the home completely during the whole time that they were sick. But yeah, so that's what they ended up having. And she thought for sure, I thought for sure that she had COVID because she was horribly sick. So it's all, you know, it's all kind of crazy. But anyway, we'll ramble on and talk all day. So we should probably wrap up here. I did want to say one more thing. I always have one more thing to say. We're talking about the phase 1 and phase 2 and, you know, the restrictions and like just the common etiquette of covering your face if you cough or you sneeze, or the distancing thing. I read something on Facebook this morning. People were having a conversation about whether to wear a mask and, you know, who's wearing mask and who's not wearing mask and the distancing. And one lady I thought was kind of funny. She said, I don't like people in my space anyway, so I kind of like this whole 6-foot thing. And she said she went to the grocery store yesterday and somebody came up right behind her, you know, just like within 6 inches. And she turned around and said, 6 feet, please. Back up, buddy, you know. And, you know, there's something to be said for giving people their personal space anyway. So some of these things can be a little more intuitive, things that we just need to remember to be aware of anyway.
I agree.
So maybe we will. So, well, it's been a pleasure as always to talk with you, and I'll see you again next week.
Thanks, Jannis. And if anybody's watching and they're interested, they can go to www.islanddirectprimarycare.com and find out more information about how our practice operates, or they can call me directly. And when I say directly, that's directly to me at 321-392-6226. That's my direct number. All my patients, as Jannis knows, has a direct line for voice, video, and text. So
and you haven't even started to regret that with me yet, have you?
Not yet. So you're awesome. Stay blessed, and I look forward to talking to you soon.
Thank you. You too.
Bye-bye.
Bye.